Hello, good morning. This is Just Listen, hosted by George Goodman. And today is May 25th, 2026. Happy Memorial Day, and I hope that you are enjoying family today. And also, we should honor our fellow veterans who have fallen. And I think that that's a good thing that we remember them and we honor them today on Memorial Day. Today, I want to talk to you about U.S. federal government policy on mental health. So, the first question is, why would I be talking about that? I'm talking about this because us as voters, need to be aware of what the government is doing on mental health in this country and also what the states are doing as well. If you've watched TV, and probably some of us don't watch the news anymore because it's always bad news, that's the way that they have it set up. But we need to look at why in the world people are just randomly, they're going after candidates running for office, they're going after candidates who are elected. This The last month and a half, 2 months ago, there have been three threats on the US president's life. And mental illness, the narrative is that it's mental illness. So we as a country really need to look at it. So let's look at what the policy is and then what the Trump policy is. So there's a couple of key things that the federal government has. There's a Civil Rights and Anti-Discrimination, which covers the Americans with Disabilities Act, protects individuals with mental health conditions from workplace discrimination, and guarantees their right to reasonable accommodations. So that is actually a good one. Americans with Disabilities Act. That's what that's about. You cannot discriminate against people because they have a disability. Insurance parity. The Mental Health Parity and Addiction Equity Act, which is MHPAEA, requires health plans to offer mental health benefits to ensure financial requirements like copays and treatment limitations like visit caps are comparable to those for medical and surgical benefits. This is another important one. We all know that work is very stressful for all of us, and we have families at home, and all of that stress. We need to make sure that insurance companies will let you get help like therapy and stuff like that. Because remember, from the 70s, only the very affluent got that kind of help. And if you look at places like California, it's big business there. The rest of us who can't afford that kind of care, we need insurance companies to offer it to us too. And so we changed the law so that, in fact, we get it. Treatment acceleration. Federal agencies, including the FDA, actively work to fast track research and clinical access for promising breakthrough treatments for serious mental illness such as PTSD, severe depression, and treatment resistant disorders. That's another important one because prior to these laws, if you didn't have the resources, meaning money, to get these done, then you were out of luck, and only the very affluent could do anything about it whatsoever. So let's look at what the Trump administration has done. So, what the Trump administration, their focus is mental illness, focusing heavily on accelerating breakthrough medical treatments, expanding institutionalization, involuntary commitment, and reshaping federal healthcare spending and insurance regulation. Okay, so there has been a problem in the country with the police knowing that people are mentally unstable, and you can't put them in jail unless they do something. It's not illegal to be mentally unstable. So what I just read, accelerating breakthrough medical treatments, expanding institutionalization, involuntary commitment, are programs where the family, if need be, can have their loved one put into a mental institution. Again, if you don't have the money and resources, you can't do it. And unfortunately, we had to pass several laws to get insurance companies to even provide this kind of coverage. It used to be, again, only if you were very, very wealthy that you could afford to do it. And people just cannot afford that. And we need to get folks off of the street if they are having problems with their mental state. And it protects us and it protects them as well. So, a cornerstone of the administration's mental health strategy is the rapid fast tracking of novel medical interventions. All right, so that was a lot for a Monday morning. Psychedelic therapy fast tracking. Under Executive Order 14401, the administration directed the FDA to prioritize regulatory review and expand patient access to perception altering psychedelic medications. So there's a whole range of them, and I won't say what they are. For treatment resistant depression, anxiety, and PTSD, specifically targeting veterans. As you are aware of, war is a terrible thing, and in the combat environment, it's really tough on our veterans. And so they needed access to getting treatment medication for depression, anxiety, and PTSD. Specifically, that targets the veterans, and that's a good thing. Priority vouchers and pathways. The policy establishes dedicated pathways for eligible patients to access investigational psychedelic drugs under the right to try rules and leverages commissioners' national priority vouchers to fast track development. That's another good thing. And with this issue, you don't see any pushback from the other political party on this. So this was a great chance for both sides to do bipartisan initiatives. State research funding. The Department of Health and Human Services was ordered to allocate $50 million through the Advanced Research Projects for Health program to match state investments in psychedelic research programs. So that's piggybacking off of that, and $50 million. Homelessness, crime, and involuntary commitment. All right. So the Trump administration has shifted federal approach away from housing first models toward treatment contingent and institutional frameworks. What does that mean? Expanded civil commitments. Through the Ending Crime and Disorder on America's Streets executive order, the administration encourages states and municipalities to use involuntary civil commitments to move unhoused individuals with serious mental illness or substance use disorders off the streets into psychiatric hospitals or treatment centers, which means that they are funding for the states to get people off of the streets if they have mental issues. Federal funding restrictions. Federal discretionary grants are prioritized for states and localities that enforce urban campaigning, loitering bans, and utilize assisted outpatient treatments. Funding is restricted for entities that engage in certain harm reduction strategy, such as safe consumption sites. All right, so that was a big political fight about 2 years ago. And if you will remember, in Oregon, there was some issues with people living downtown. They were mentally ill. There was also some in California, and they were getting money, but they were allowing people with mental illness to just live downtown. And it became a national issue when a couple of people got killed and they were harassing people. So the states have, like Oregon and California, have, excuse me, have pulled back those initiatives based on that so that they can get the federal funding. And there are certain areas, cities, towns that have buildings that they can use for people to stay at. And they didn't get rid of the people. They wanted to house them in an area where they would have protection, and also the public would have protection from them so that they could get the right help. So that was another good one. Housing limitations. So HUD has tightened regulations regarding mental health accommodations, including limited exemptions for untrained emotional support animals in public housing, framing widespread uses as a policy loophole. All right. Don't know much about that one, but apparently people had animals and they either abandoned the animals or the animals were living in some pretty bad environments. So they had to do something about that. So housing limitations. And remember, this one is under an executive order. So when the next team gets into office, they could pull it back. Okay, healthcare deregulation and insurance parity. So the administration has taken a deregulatory stance toward insurance mandates regarding mental health coverage. Rollback of parity regulation. So the administration announced it would not enforce Biden-era regulations strengthening the Mental Health Parity and Addiction Equity Act. Those past rules would have required private insurers to explicitly provide equivalent coverage and financial parity for mental and physical health conditions. Also, Medicaid and safety net restrictions. Legislative actions and budget goals seek to reduce funding for Medicaid, the largest single payer for mental health and addiction services in the U.S., which critics argue impacts coverage access for low income patients. Okay, so this is an example of what I'm telling you about. When stuff is under executive order, you either agree or disagree, and you rally behind that to vote for the candidate that agrees with you. So those are the rules so far under healthcare deregulation and insurance parity. Those were pulled back, and the issue seems to be who gets the coverage. And That federal poverty level probably played in with that too. And basically, what that means, unless you're dirt poor, you can't access it anyway. And maybe they made it so that anyone can get the help and not just target a certain group. So that's what that is about. All right. So federal consolidation and budget restructuring. Last but not least, so the administration budget proposals seek a major structural reorganization of federal health and research agency. So, the under the proposed plans, the National Institute of Mental Health will be folded alongside Addiction Research Institute into a single unified National Institute of Behavioral Health. So you're combining resources of both of those. Block grant consolidation. The administration seeks to merge the traditional community mental health services block grant with substance use grants into a singular behavior health innovation block grant while restructuring the substance abuse and mental health services administration. So both of those are consolidation, and the money did not go away, but when they merged them, it's the budget includes both. They don't have separate budgets, and that's a cost savings for the American taxpayer. So, mental health is important, and I think that policy from the federal government is very important. Kind of went long at the end. Sorry about that. This is an important thing to talk about from the perspective of people who are mentally ill committing random acts of violence. And that's why this issue is important to talk about, and it's important that the federal government has a strategy so that innocent people are not killed, and that people who have mental illness have access to the resources, meaning them and their families, so that their issues can be addressed. This is Just Listen, hosted by George Goodman. Let me know what you think. I apologize for going a little bit longer, but this is an important issue. Have a great day, and say hello to a veteran today, and enjoy your day.